My name is Dr. Sherry Tenpenny, and I'll be walking you through this presentation, introducing you to what Tenpenny Integrative Medical Center has to offer. Imagine what your life could be if you could achieve all your health, wellness, and well-being goals. First, a little bit about us. Tenpenny Integrative Medical Center is a multidisciplinary health center that delivers personalized, integrative medical care. Our vision is to be a well-recognized name throughout Northeast Ohio and across the world, known for getting people well and symptom-free without pharmaceutical medications. Our mission is to deliver personalized, holistic medical care, individualized to each person's needs. Our focus is to use both conventional and integrative medicine testing procedures and holistic solutions. We are proud to share that patients have traveled from all 50 states and at least 17 countries to get well and free from their pharmaceutical medications. We partner with each person to help them achieve optimal health. How did we get started? I get asked that question frequently. Our company's history is rich with people, changes, and opportunities. I want to share a few of the highlights of our journey with you. In 1994, OsteoMed was formed by me, Dr. Sherry Tenpenny, in Findlay, Ohio. That practice was solely dedicated to osteopathic, manual medicine, and acupuncture. In 1996, I moved OsteoMed to Strongsville, Ohio, where it became OsteoMed 2. In 2004, OsteoMed 2 moved to Middleburg Heights. In 2006, we experienced a devastating office fire. Fortunately, no one was hurt, but the fire was a defining moment in our business, proving our tenacity to survive to continue to serve our patients. In 2010, we moved to our current office and changed the business name from OsteoMed 2 to Tenpenny Integrative Medical Center, also referred to as TIMC. In 2016, we celebrated our 20th year serving patients from all across the country and around the world. This is our philosophy and our commitment to our patients. To be thorough, we use all the tools in our toolbox, both alternative and conventional, for testing and for treatments. We dig deeper to find solutions. We look for causes that no one else has thought to consider. We provide options. As independent practitioners, we can give you as much time as you need. We do our very best to walk the talk about health. We take supplements, we get allergy treatments, and we have the same annual tests that you do. We investigate new innovations for improving health. We are constantly exploring new, cutting-edge diagnostic tools and treatment innovations. We then consider if this new option would be a good fit for our practice and a good option for you. We are committed to being open to new ideas. We love it when patients bring in something that they have read, an article, a book, or a website, so we can discuss its value and its applicability to their personal current health condition. We work hard to impact our patients' lives at every level: physical, mental, emotional, and spiritual. And most importantly, we give hope. We believe that hope is the most important element for healing. To deliver on our commitments, we use this simple model to evaluate each person's individual health and current state of well-being. This is a model that I designed back in the mid-1990s. This represents the house that you live in called your body. The various components are anatomy, physiology, biochemistry, and energy. Anatomy is bones, muscles, and organs. Physiology is how everything works, how you breathe, digest, absorb, and eliminate. Biochemistry is actually what you eat, the fluids you consume, and the quality of air that you breathe. Energy is the foundation of all of it, and there are three components of energy. There is mental and emotional energy, because you know how you feel physically when you are happy and when you're not so happy. There is chemical energy. Everything that you eat, whether it is a carbohydrate, a fat, or a protein, is eventually turned into a chemical particle called ATP. ATP is the body's gasoline. And then there is the electromagnetic part of the human body. Acupuncturists call it chi, Ayurvedic specialists call it prana, chiropractors and other holistic practitioners refer to it as your life force. I look at it as though the energy in your body is like wires running through your house. You can't see them, smell them, touch them, or taste them, but little switches in the wall can turn them on and off to make big differences in whether your house is cold or warm, dark or light. The electromagnetic energy that runs through the body is the physics part of the body. Our body is made of chemistry and physics. Most of Western medicine depends on chemistry, blood tests, saliva tests, urine tests, and the treatments are in the family of chemistry, which can be a pharmaceutical drug, a vitamin, or even food. All of those things are considered chemistry. But there's this other portion of your body, which is the physics part. It's how your brain works. The electricity in your heart is how your heart beats. The electricity that runs down the nerves in your arms is what makes your extremities function. Western medicine practices energy medicine every day. They just don't call it energy medicine. When your doctor orders an EKG, he is measuring the electricity or the energy of your heart. When he orders an MRI, which stands for magnetic resonant imaging, they are measuring the energy patterns of little protons that are flipping back and forth, measuring the magnetic resonance of your cells. The pictures that come about from these measurements are put together by very specialized software. When you get an EEG looking for seizure disorders, that is measuring the electricity or the energy of the brain. When you get an EMG, that is measuring the electricity of the nerves in your arms and legs. It's the type of test that is looking for impingement of perhaps carpal tunnel. So conventional medicine uses physics every day and uses energy medicine every day for diagnostics. But rarely, if ever, is energy used for treatment in conventional medicine, with the exception of burning radiation. So the sum total of your body is the interplay between chemistry and physics, between anatomy and physiology, what needs to be taken in terms of biochemistry, and most importantly, the foundation of energy. So now that you know how we assess most patients that come into our office, we are looking for areas of concern in anatomy, physiology, biochemistry, or energy disruptions. And then we are looking for ways to assess structural abnormalities and how to address them. We assess the function of your lungs, your kidneys, your digestion, your elimination. We evaluate what you eat and drink by discussing your diet, and we order very specialized tests to look for specific nutritional deficiencies or perhaps toxicities such as heavy metals. And when it comes to mental and emotional challenges such as anxiety, depression, and insomnia, we have many options to discuss, coach, and help. We believe that all of your thoughts and feelings are part of your personal health and well-being and part of universal energy. If we don't address these energetic disruptions, treating the body soma alone is not going to relieve your dis-ease. So now that you know what each one of these boxes stand for and how we assess the various divisions within the human body, this is an overview of the types of therapies that we use to address these deficiencies. We use osteopathic and chiropractic manipulation to address structural abnormalities in your anatomy. We have a specialized injection therapy called MIT that we'll discuss in a few minutes. We frequently recommend stretching exercises. When we talk about your physiology, we are looking to identify toxicities that need to be eliminated, and we can identify areas of concern with two tools that we use, thermography and a thyroflex test. We use specialized testing of blood, saliva, urine, and stool. We are looking for nutritional deficiencies, your level of hydration, and specific missing nutrients. When it comes to energy, we frequently do tests to assess the level of neurotransmitters in your body to improve sleep and lifestyle habits. Since all of your food turns into the chemical energy ATP, we want to make sure you have adequate mitochondrial support and enough probiotics and digestive enzymes in your GI tract. And the energy part that runs through your whole body and can disrupt every area that we've previously discussed are unrecognized and unattended food and environmental allergies. And that's where our specialized testing and treatment called SRT comes into play. So let's drill down to the specifics of each service that we offer. And let's start with anatomy, the muscles and bones. Founded in the 1890s by D.D. Palmer, chiropractic is based on the philosophy that alignment of the spine through the use of manual therapy is essential for good health. At TIMC, chiropractic manipulation is provided with a special focus on sports medicine, trigger point release, and wellness visits. We have a chiropractor at TIMC, and we work together with many of the chiropractors in the surrounding communities. For example, your personal chiropractor may refer you here for the specialized testing that we do. We always like to refer you back to the practitioner who had confidence enough in us to refer you for our specialized care. Osteopathic medicine was founded by Andrew Taylor Still at about the same time that D.D. Palmer founded chiropractic. In fact, there has been a long-standing banter between the two professions about whom started the concepts first, and did one person steal it from the other. Andrew Taylor Still was a medical doctor who was disturbed by the medical practices of the day. When asked the question, "What is osteopathy?" he replied, quote, "Osteopathy is the scientific knowledge of anatomy and physiology. The hands of a skilled person applies that knowledge to heal the sick and wounded. An up-to-date osteopath must have a masterful knowledge of anatomy and physiology." Actually, shouldn't every physician have a masterful knowledge of anatomy, physiology, and biochemistry instead of just handing out prescriptions for a living? But I am an osteopathic medical doctor. I grew up in a chiropractic family. I knew the value of hands-on healing because my father, my grandfather, 3 uncles, and 2 cousins were chiropractors. So when I decided to go to medical school, that is the reason I wanted to become an osteopathic physician, was to be able to apply hands-on healing to all of our patients. Osteopathic manual medicine overlaps in certain ways with chiropractic, but there are distinct differences. Osteopathy uses subtle techniques to address conditions in various parts of the body. These techniques are called muscle energy, Jones counterstrain, myofascial release, and osteopathy in the cranial field. Both osteopathy and chiropractic can deliver types of techniques known as high velocity, which many people think may refer to them as rack, crack, or crunch. Yes, osteopaths and chiropractors both provide these types of treatments, but both professions have their own subtle ways of treating patients. At TIMC, I have a special interest in using cranial osteopathy to address abnormalities in the skull referred to as plagiocephaly. Sometimes by correcting these abnormalities, such as flathead syndrome and crooked heads, this can resolve health issues such as chronic reflux, chronic ear infections, crossed eyes, and just the structural abnormality of a crooked head. Another area of anatomy we specifically address is breast health. A clinical breast exam can detect abnormalities in breast tissue and may be the earliest identifier of a stage of concern. A clinical breast exam can even find tiny masses that are missed by a mammogram. In at least 4 studies, the number of cancers identified by breast exam alone ranged from 4.6% to 10.7%. A clinical breast exam is part of our breast thermography program, or it can be scheduled as a separate exam if you have an area of concern and wish to be examined by knowledgeable fingers. At TIMC, we use a special technique called a Mammocare breast exam. With this technique, every area of the breast is examined at 3 levels: superficial, intermediate, and deep. We are confident that this will be the most thorough exam that you have ever had. In addition to chiropractic and osteopathic manipulation, we offer mannitol injection therapy for localized acute and chronic pain. This is a technique developed by New Zealand medical doctor, Dr. John Liftoff. The technique involves a series of tiny injections of mannitol, a type of sugar, into painful areas along specified pathways. Since 2005, Dr. Liftoff has published at least 6 studies in the Australian Journal of Musculoskeletal Medicine on the success of mannitol injections to treat Achilles tendon injuries and other types of pain. MIT, as we call it, has been offered at TIMC since 2014. It is used to address acute and chronic low back pain, carpal tunnel syndrome, arthritic knees, neck pain, headaches, tendonitis, and more. It is used for treating specific localized pain, but is not used for generalized pain such as fibromyalgia and rheumatoid arthritis. At this time, fewer than 300 physicians in the United States have been trained in this technique. I am proud to be able to offer this unique and effective pain treatments to our patients at Tenpenny Integrative Medical Center. Now, referring back to our house model, let's move on to focus on physiology, how things work. Let's talk about thyroid health. Approximately 30% of our patients come to us with concerns about their thyroid. TIMC offers a very unique approach for assessment of thyroid health, including specialized blood tests and natural thyroid hormone prescriptions. We also have a tool for identifying subtle abnormalities at the cellular level of the functionality of your thyroid hormones. This tool is called a ThyroFlex test. The ThyroFlex assessment is based on the principle that slowed reflexes can demonstrate low thyroid hormone levels within the tissues. This in-office 5-minute test can identify subtle thyroid dysregulation that cannot be identified using routine laboratory blood testing. The endocrine and reproductive organs must work together to be in balance. Your thyroid gland is part of a system, the thyroid, adrenals, and reproductive organs. We work to rebalance all of these together. TIMC prescribes several different types of bioidentical estrogen, progesterone, and testosterone hormones, including topical creams, topical drops, intravaginal creams, and oral preparations. We tailor the treatment to your needs and your overall health. And we prescribe these hormones for men too. Your connection to the world is through your GI tract. What you eat, how you digest and absorb your food, the nutrients you take, and how you eliminate the residual waste is key to your overall health. In fact, buried within the walls of the digestive tract is your second brain. The gut-brain connection can impact your immune system, mood, and even your ability to think clearly. At TIMC, we believe that eliminating GERD, irritable bowel syndrome, constipation, and chronic diarrhea are critically important to maximizing your ability to be well. We can do this through our SRT program, which we will discuss in a few minutes. Or we can order either food allergy assessments or specialized stool testing if we want to assess the balance of good and bad bacteria in your gut or evaluate your stool for parasites. Breast thermography is an FDA-approved tool for non-invasive, pain-free assessments of breast tissue in both women and men. An infrared scan is used to identify asymmetric heat patterns, which can often be reversed through dietary changes, exercise, and specific breast supplements. Extensive studies performed throughout the 1990s demonstrated that an asymmetric heat pattern may be the earliest signal that something is awry and needs to be addressed in the breast. This is the true meaning of early detection. So why is it that thermography is dismissed by conventional physicians? In my opinion, there are 3 primary reasons why your medical physician seems to totally dismiss a thermogram scan. Number 1, a thermogram is a test of your physiology. A mammogram is an X-ray of your anatomy. Physicians do not understand the value and limitations of the thermographic image and of the thermography tool. Number 2, doctors have been taught to say thermograms don't diagnose cancer. They are right. Infrared scans do not diagnose cancer, but neither do mammograms. On the bottom of a mammogram report, you will often see a disclaimer that says this mammogram may have a false negative rate of up to 25 to 30%, meaning that a cancer is present, but it cannot be seen in 1 in 4 or 1 in 3 women using a mammogram. Historically, a thermogram can have somewhere between a 3 and 5% false negative rate. We can discuss these differences in detail when we see you in our office for a thermogram review. The third reason conventional doctors dismiss thermograms is they don't know how to address an abnormal scan. Thermograms are scored on a scale of 1 to 5, with 1 and 2 being normal, 3 being equivocal, and scores 4 and 5 considered to be high risk but not diagnostic. If you have a thermogram with a score of a 4 or 5, yes, we will order a follow-up mammogram and an ultrasound. We believe these tools should be used appropriately for diagnosis. We believe that they are overused and inappropriately used for screening. Once those assessments are completed, we will address any abnormal findings and recommend nutrition, lifestyle, and supplement changes. Importantly, thermograms are an assessment of breast health and can identify areas of concern up to 7 to 10 years before the abnormality can be officially diagnosed on a mammogram. This gives us time for the body to heal itself and actually avoid evolving into breast cancer. Here are a few quotes that go all the way back to the 1980s, when very large studies were done using thermography for screening. Some of those early studies had between 30,000 and 60,000 women in them. They were not small anecdotal reports. This study that was published in 1982 concluded that, quote, an abnormal thermogram is 10 times more significant as a future risk indicator for breast cancer than a first-order family history of the disease, meaning that finding an abnormality on your thermogram is more important to be addressed than knowing that you have a family member such as your sister or your mother that have a history of breast cancer. This study was published in 1980 with the following conclusion. An abnormal infrared image was determined to be the single most important marker of high risk for developing breast cancer. The single most important marker, and yet conventional medicine has thrown this valuable additional assessment tool underneath the bus. Now that we've talked about anatomy and physiology, let's move on and take a look at what we can do to optimize your personal biochemistry. Again, biochemistry is what you eat, drink, and breathe, including the supplements you take and the nutraceuticals that you consume. At TIMC, we spend a significant amount of time during each visit talking about your diet. We do not believe that there is a one-size-fits-all diet plan for everyone. However, we encourage the suggestions that are put forth by the American Academy of Lifestyle Medicine. Number 1, eat real food. Stuff that comes out of a box, a can, or they hand you through a window is not real food. So eat real food. Number 2, eat mostly fruits and vegetables. And if you're going to eat meat, eat the best quality, cleanest meat, fish, chicken that you can find to buy. And thirdly, and maybe even most importantly, eat small portions. Don't do the supersize me thing. Most Americans have an issue with obesity, and the main problem is usually the quantity of food that they're eating. For most people, we strongly encourage gluten-free. We believe that gluten is strongly pro-inflammatory and it disrupts the tight junctions in the GI tract that can lead to leaky gut syndrome. So we have long discussions about gluten-free living. We strongly encourage limiting or completely eliminating what we call the 4 great whites: white sugar, white bleached flour, white rice, and white pasteurized cow's milk. For overall gut health, we strongly encourage the use of digestive enzymes taken with each meal and probiotics, preferably taken at bedtime. This is a long list of specialized tests that we offer at TIMC, and we draw our own blood in our own lab. All of these tests and what they are for are listed on our website. We do our very best to work with your insurance, so if it's economically better for you to go to an outside lab or to the hospital to have your phlebotomy done, we will write out the order form for you to take with you. If you traveled a great distance for your first visit, we can often send the laboratory results to you by mail and do the review by phone. We take great pride in knowing our vendors. We use only a few hand-selected manufacturers, and I have visited many of the manufacturing facilities of the companies we use for our supplement shop. The revenues generated through our retail sales are very important to the overall success of our business. We really appreciate our patients' trust in these products that we have selected, and we are grateful when you choose to fulfill your supplement needs with us. We have many hypoallergenic options, and sometimes we can provide the supplement for you as a sublingual spray or as a liquid drop. One of the most important elements that we address at TIMC are the energy needs and energy imbalances within your body. The body is made of chemistry and physics, which we've previously discussed. All the tests of electricity ordered by your doctor are simply testing for imbalances in your energy systems. At TIMC, we offer our cornerstone treatment called SRT, which stands for Sensitivity Reduction Technique. We use muscle testing to identify the irritant and then acupressure on specific acupuncture points to rebalance the body's energy systems. The result is that the person is no longer reactive to the allergy, such as trees, grass, mold, perfumes, a long list of foods, and even dogs and cats. I am proud to tell you that patients have come from all 50 states and about 17 countries to go through our SRT allergy elimination program. The effect of SRT treatments is long-lasting. We have patients who have completed the program more than 15 years ago and are still symptom-free from the offending food and environmental allergies. How do we know? Because many of the children that we saw are now grown up, married, and bringing their own children back to our clinic to get well. Overall, our SRT treatments are about 85% effective for addressing many conditions in both adults and children. Our youngest SRT patient was 1 week of age. She had horrible reflux and could not tolerate her mother's breast milk, which we corrected in about 4 visits. And we've treated patients who are octogenarians with similar success. What types of conditions have we used SRT to address in our clinic? We have used it to treat nearly every condition. I can list a few here: asthma, allergies, eczema, irritable bowel, Crohn's disease, ulcerative colitis, interstitial cystitis, headaches, anxiety, hormone imbalances, and of course, food and environmental sensitivities. Homeopathy was developed by a German physician, Dr. Samuel Hahnemann, in the late 1700s and has been practiced around the world continuously since that time. The practice of homeopathy is based on scientific principles, including the principle of similars, whereby patients are treated with medicine selected specifically for their symptoms and dispositions. Homeopathy can be used to safely and effectively treat many acute and chronic conditions in both children and adults, such as ear infections, viral illnesses, teething, behavioral disturbances, vomiting and diarrhea, sinus problems, arthritis, sleep problems, and more. Homeoprophylaxis is a method used to protect individuals from the effects of infectious illnesses. In contrast to vaccination, homeoprophylaxis does not rely on the antibody formation to prevent an illness. Instead, homeopathic remedies boost the innate immune system to lower a person's susceptibility to illness. Homeopathy improves the Th1 side of the immune system and strengthens macrophages. So there you have it. We have a complete focus on the human body, from anatomy and physiology to biochemistry and energy. Each of our practitioners are highly trained in every area that we provide. We look forward to taking care of you soon. And one last thing. For nearly the last 20 years, I have invested more than 30,000 hours of personal time studying problems associated with vaccines. I am considered to be an internationally known expert on problems associated with vaccination. I'm very involved in the vaccine industry, and it's very important to me to educate so that people will know to ask questions and not just blindly allow themselves and their children to be vaccinated. I have one other website of interest that I hope that you will join. At Vaxxter.com, VAXXTER, we have daily updates and information on vaccination and current events. That is where I post my blogs, and we have many educational opportunities for you also through Vaxxter.com. So I want to thank you so much for being here and learning a little bit more about Tenpenny Integrated Medical Center, the services that we offer, and our staff that I am so proud of. We look forward to walking with you on your journey to optimal health.